Assalamualaikum warahmatullahi wabarakatuh. We are from ISM KPP3. We present our project. This is the table of contents for our presentation, which are introducing for group member, explanation of case study, ER and EER diagram, and lastly, relational schema. Assalamualaikum warahmatullahi wabarakatuh. My name is Syakirah Binti Muhammad Sedek. My matric number is 055083.
Assalamualaikum. My name is SHUHADA Binti AZIK. My matric number is 055371.
Our good choose case study, which is clinic management. Clinic may be a clinic that primarily focus on the care of the outpatient. Clinic can be privately operated or publicly managed and funded. Clinic has many clinic according to the place and city. Each of clinic has clinic code, clinic name, address, and city. Patients that have different kind of ailments come to the clinic and get treatment done from the concerned doctor. The patient who visit the clinic must register first by fulfilling the certain formalities such as name, contact, telephone number, address, age, and gender. After register at the registration center, they will be called to the concerned doctor and the doctor do the treatment. According to the ailments, doctor will record the treatment in medical record such as record number, date, AZIK for the further treatment if needed.
This is the ER diagram for our case study. Entities are the object or concept that represent the important data. Patient, clinic, doctor, medical record, and tests are the entities, which is represented by the rectangle shape. Each of the entity is made up of some attribute, which represent the entity. In other words, attributes are the characteristic of an entity. So, here, the attributes are represented by the ellipse shape, which the attribute for the patient is P number, P contact, P name, address, age, and gender. For clinic, the attributes are CCT, C address, C name, and C code. For the doctor, treatment, medical record, and test, each entity has their own attributes. Next is the relationship. Relationship is an association among two or more entities. The diamond shape represents the relationship type. Here, the relationship between patient and clinic is registered. So the meaning here is the patient needs to register at the clinic first. For the clinic and doctor, it has relationship. Each entity has the relationship to associate with another entity. Here, we can see that there is a symbol which are M, N, and 1. The symbol between patient and clinic is many to many, which means that many patients can register at many clinics. The symbol between doctor and patient means that a doctor can give many treatments to a patient.
Firstly, for the clinic, there are some attributes, which is clinic code, clinic address, clinic city, clinic name, patient number, and doctor ID. Primary key for the clinic is clinic code. Foreign key for the clinic is patient number and doctor ID. Secondly, for the doctor, there are some attributes, which is doctor ID, doctor name, doctor gender, specialty, patient number, and clinic code. Primary key for the doctor is doctor ID. Foreign key for the doctor is patient number and clinic code. Third, patient. There are some attributes, which is patient number, patient name, patient contact, age, gender, address, doctor ID, record number, clinic code, treatment date, and test number. Primary key for the patient is patient number. Foreign key for the patient is doctor ID, record number, clinic code, treatment date, and test number. Next, treatment. There are some attributes for treatment, such as treatment date, patient number, doctor number, and treatment type. Primary key for the treatment is treatment date. Foreign key for the treatment is patient number, doctor number. Next, medical record. There are some attributes which is record number, record date, allergy, treatment type, patient number, treatment date and test number. Primary key for the medical record is record number. Foreign key for the medical record is treatment type, patient number, treatment date and test number. Finally, for the test, there are some attributes which is test number, test type and patient number. Primary key for the test is test number. Foreign key for the test is patient number.
In the conclusion, we can see that the diagram and the relational schema provide the ability to design the database with precision. It also gives the visual outlook of the database, which is the details of the relationship and attribute of the entities pave the way for smooth database development.